So my own attention is to make sure there is no blood. So the moment the baby came out, the woman took it. So I wasn't concerned about the sex. It was when they were saying, bring the Nkewoke. So the second nurse now brought the baby and showed the woman. The woman said, no, where is the male child? I said, madam, you delivered 2 female. Osumba. Now the hospital has changed. We are still operating. It's only her in the theater, and the baby has not left the theater. The neonatologist is still there cleaning the baby up. In fact, the husband is in the reception, and so there's no way you will leave without seeing the. To worsen it all, they had an ultrasound that showed two female child, but somehow the woman has gone and somebody had told her that your faith can do miracle. So in her mind, she's expecting a male child. That's why the child that ultrasound had told her is a female child. And the only way she could go through that psychological turmoil is to believe that a male child is coming. And she believed that eventually we have a female child, which is what we're expecting. But just know that the joy Ogeje Kunwahana is not the same joy when she was told that she has 2 male child. It's just African mentality. So when we talk about the psychological aspect in pregnancy, this thing goes round to affect the way the woman looks at this pregnancy. If a woman has already had 6 female child and she is pregnant for the 7th one, and so suddenly she realizes it's a female child, she starts bleeding, having threatened miscarriage. You come and tell her to stay in the hospital for 1 month for bed rest. She will not even listen to you. That is their mentality. But if she now have a male child, the first one be male child, and you are telling her to go, she will be the one that will tell the doctor, I don't want any studio. If to stay, let me stay. I don't even understand. So that woman, the joy in her will make her to overlook certain pain. In fact, during the course of delivery, their cooperation will be different. And that is Africa. So when we talk about psychological, most times, it is not a medical issue. It's a psychological thing. And most of them will not tell you until you ask around. Just like a young lady that comes to the clinic to tell you that sometimes did he just start? She will tell you no, that it had been happening.